Thanks a lot. Hi, I'm Christian, CEO and founder of Meru Health, and we are a digital clinic for greater mental health. And I want to start off with telling about why I founded the company. So I was building my previous business in diabetes, a medical device company, which I eventually sold in 2015 when I lost my brother Peter to suicide because of his depression. And that's when I realized, after selling my previous business, that I looked into the problem more widely and kind of went through my own kind of recovery from that, and then realized that there's a huge problem out there, and that there are really poor solutions out there for access and quality of care. We know how to treat depression and anxiety nowadays, but actually, if we look at the statistics, they're not that great actually. So, what are the challenges in mental health? So why are we tackling the problem? So access is number one. That's clearly a huge problem. Like, even in Texas alone, 2 million people every year don't receive the level of care that they would need. And that's kind of globally, it's like, 200, 300 million people. So that's kind of one important piece. And then how are we kind of tackling this problem? So improving access, improving quality of care. So we basically kind of came up with having experience in healthcare previously, like that, if you sell software to clinics, that has its benefits and it's possible. I've done that myself in the past. But we really wanted to solve the whole problem with Meru. So we wanted to be the provider utilizing the latest and the best technologies and also the latest clinical guidelines and knowledge on how to treat these conditions. Therefore, we became a clinic, a provider, a physician-led organization. And we have an app-based treatment program and with daily support from licensed therapists and psychiatrists for our patients. So what else? So we also figured that, we have to be able to do better than the current standard of care. So we implemented Biofeedback to help people, in addition to going through the psychotherapeutic program, to also practice and do biofeedback, getting instant feedback on their kind of learning of self-regulatory skills and helping them stop their panic attacks and learn these skills which everyone can learn that are tremendously helpful in depression or with depression and anxiety. And we have very strong evidence already published and more to be published later this year on this. So who do we work with? So we work with self-insured employers or health insurance or insurance companies, health plans. And we also work in an ACO setting, as an example, with Sutter Health in California, and then with managed care, in a managed care setting in Colorado with Mines, and then a bunch of large self-insured employers. So helping them manage their depression and anxiety populations. Okay, then science. So we have a long background in healthcare and also research and publications, and also wanted to do proper work with Meru. So we started off with in the first couple of years doing clinical research, and we just now in January published our first trial with very strong results, and have 2 more papers in peer review, including a 12-month after treatment paper. So we have data in peer review from 12 months after the treatment completion for our patients, and it's roughly 5 to 10 times better than standard of care at 12 months after treatment. So we're pretty excited about that, and we're working with Stanford and others in our research collaborations. So then what's happening, where are we heading? So we're heading towards working with more and more national payers and larger health systems, ACOs. So that's kind of where we see that we can really add a lot of value. And we've even done value-based deals or outcomes-based deals where we take a lot of risk on our outcomes, as an example in an ACO setting. Couple of final points. What's kind of special here? So it scales better than normal behavioral health, better than normal therapy with the technology. So we kind of like to call it that we give our providers superpowers. So it's roughly 10x more scalable than normal face-to-face therapy or teletherapy. And again, access is very quick. People get access in a few days, and then the outcomes are just outstanding that are now in peer review and already published. And we're looking to connect with health systems and provider networks. And also health plans. So that's who I would love to talk to today. And also so that no one needs to go through the same stuff that my brother went through back in the day. So there's a lot of people we can help here. Thanks a lot.
Got one.
Yeah, so you're asking if like this could be deployed directly with employers for their employees. Yes, that's exactly what we've also done with like Cisco and Intel, where they wanted to make this available to their tech employees in the Silicon Valley area. And it's through some of the on-site clinics, but it's also possible to do like direct marketing to the employees, like, hey, here's a discreet way for you to get access to top-notch quality mental health care.
One more to the right.
Yeah, so actually we're already kind of quite far in building that kind of a relationship with them. So basically, yes, we have a lot of data from our patients. We can definitely feed that back to the extent that it's allowed, like PHI of course and HIPAA and all that. But definitely, and we are already like now building a framework for billing through claims and being able to kind of sit in the medical budget rather than in the wellness budget. So that's the plan. Thanks. Thanks a lot.
Thank you.